Dental implants are root replacements. So it's man-made roots that are replacing the root of a natural tooth so that we can put a cap or a crown on that and someone can have their tooth back. It's the closest thing to nature that we have at the moment until we learn how to regrow teeth, and may that happen somewhere in our near future. But at the moment, this is the best that we have. Dental implants are made of surgical grade titanium. There are also some that are being made out of zirconium as well, but the surgical grade titanium ones are the ones that have a really long track record of decades and decades of use. So very biocompatible, an excellent way of replacing a missing tooth. There are three ways of replacing missing teeth. There's either removable dentures or bridges, and bridges hold onto a tooth in front and a tooth behind for support. And then of course, not touching those teeth on either side, just replacing the root of a tooth, whether it's one tooth with one root or many teeth with many implants. It's all possible to do that, but that's the closest thing to giving someone their teeth back and having it look natural and function naturally. You can replace one or all, just depends on the patient's needs. But as long as there's sufficient bone that we can place the man-made root or dental implant where the tooth was, then we can build a tooth on top of that with a cap or a crown and then restore that area to natural form and function. Once an implant is placed, what your body does naturally is bone healing, the same as if you broke your wrist or your leg. They immobilize things with a cast, and then there's bone healing, and it takes approximately 8 weeks or so. Usually we'll wait 3 months or 4 months for the bone to fuse to the implant. It becomes part of your jaw. Once that happens and it's stable, we can actually put a tooth on top of it, and you take care of it just like you would your natural teeth, brushing twice a day, flossing once a day, etc. It's an awesome way of replacing missing teeth. Well, your home care, you treat it like a normal tooth. When you come in for your preventive care visits at your dentist, it's treated very much the same way, but it needs to be monitored because we'll take x-rays to make sure the bone level is still consistent from the day that it was placed. But as far as routine care, almost identical. A single implant with a crown on it costs approximately the same as a bridge that covers 3 teeth, because we need to hold on to the tooth in front and hold on to the tooth behind. The costs are very, very similar. So at that point, I would rather not disturb the tooth in front or the tooth behind and have a single standalone tooth, just like your natural tooth was, for the same price. And statistically, that should outlast the bridge. If done correctly, then they are indistinguishable from a natural tooth. There's 3 stages to the implant process. So I often talk to patients about building a house. You've got the foundation, the framework, and the roof. And similarly, you've got the foundation of the dental implant, and then you got the framework, or the part above the gum, and then the roof or the crown that goes on top that looks like a tooth and blends into the rest of your dentition. Functions just as well. Certainly, there isn't any reason why it couldn't last for decades. We don't have any 18-year-olds that have lived to 100 yet, but for all intents and purposes, there's a high probability that it can last a very, very long time. It is not without problems, but again, very, very, very high success rate and a very good long-term investment. Yes, it is possible for the implant to not integrate into the bone. And statistically, it can be as little as 2% of the time. But when that happens, often what we do is just let the bone heal in that area, and then we can go back in and place a new implant in. And then it just lengthens the overall finishing of the treatment, but it is possible to restore that area. We really appreciate all the great questions that have been sent in. And if you want to send in your question, please contact us at maplefamilydentistry.com. And remember, continue to ask and smile.